Thanks for taking some time for me, man. I truly appreciate it.
Yeah, no, absolutely. Thanks for reaching out and getting a hold of me. This is we're excited.
Yeah, I mean, we've done several interviews already with a lot of the software companies, but
Yeah.
like when I saw your particular platform, it just brought back some bad memories when I used to run my agencies, directly,
Sure.
and spending all those time, like having to waste time calling and stuff like that. So,
Yep.
that's really nice that you guys have that set up.
Yep. No, you're exactly right. Like I say, bringing back some old memories. I spent 13 years in home health care myself.
Awesome.
And so probably the same memories you have, the same memories I have in home health care. So that's what it was. We wanted to create a solution for communication. As we continue through technology, more and more people are not answering their phones and they're not checking their voicemails.
Yep.
So, a lot of these home health care companies we found that were resulting into, using their text messaging for their communication. So, whenever I was in home health, our, schedulers, our administrators were using text messaging to communicate, which at that time it was fine because that was the best way to communicate.
Mm-hmm.
But there's a lot of problems, around communicating through text messaging, and we can kind of get into that a little bit. But that's really where we wanted to kind of step out and create, a safe, HIPAA compliant environment, for these home healthcare companies to communicate, with their clinicians in the field.
Definitely, man. Definitely. So, I mean, like, just to let this whole thing that we're doing right now is it's really just trying to give value to a lot of the people.
Sure.
So like we have over an 11,000 email list now, which is amazing.
Right.
And that's both home health and home care, just to let you know. It's about 70% home health agencies, and then 30% is the home care.
Okay.
Just to give you the background and stuff like that. But yeah, so I mean, you had 13 years of experience. So tell me about that. What were you doing within those 13 years? Were you like an administrator, an owner of a company?
Yeah, no, good question. So I started off in home health care, specifically private duty nursing.
Okay.
We provided nursing and therapy for kids with special needs, anywhere from newborn to up to 21 years of age, primarily. So I started off as a scheduler. I worked for a very small company here in Dallas, Texas at the time, where we had 2 locations. And when I first started, we wore many hats. We were responsible for bringing in new hires, for recruiting, for new hire paperwork, for communicating with our patients and the patient families, and staffing, on top of billing, payroll, kind of everything that a small company has to endure. And as we continue to grow, I moved into what we call an executive director role, where I oversaw a single location out in East Texas, out in Tyler, Texas. And I did that for about 7 years, and then moved into a regional operations director role, where I oversaw, many sites, many locations, and different service lines. So we got into, we had the PD and therapy, so a little bit of DM.
Kind of cut off there a quick second there.
Oh, did you? Well, what did we?
Where you went from the therapy, moving on.
Okay, yeah. So I was of course running that branch director, or oversaw that single location. I did that for about 7 years, and then moved into a regional operations director, where I served as overseeing many sites and many service lines within the organization at that point.
Awesome. So
yeah.
let's just go back. When did you make a decision that you wanted to start a company like Notified, for example?
Yeah, no, great question. I think going back to just, the experience in home health care, always, thinking there had to be a better solution to the way we were communicating, today. Again, kind of in 2005, before, the smartphone really got popular, before apps really got popular, the main form of communication was through a phone call. And that's how we spoke to each other. But as I mentioned a little bit ago, as technology got better and better through the years, text messaging became the norm for your clinicians in the field and for the back office. But I would say it was around 2016 is whenever kind of the thought popped in my mind about, okay, what if we had an application that clinicians could download in the field that we could communicate with them back and forth in a HIPAA compliant, safe environment, and at the same time be able to broadcast information out to them. So to where your standard, form of communication today is you text message one person or you call one person, to where you could actually go in and communicate with 500 people, 1,000 people. You could get information out to 1,000 in a few minutes, as opposed to picking up the phone and dialing one by one over and over and over, and more than likely leaving a voicemail and waiting for a return phone call, which very rarely happens as well. So around 2016, started working on it, started putting some pen and paper together. I got with a friend of mine from high school that was an app developer at the time. We started meeting up, after working on weekends, just kind of talking about what this would look like, and had some ideas. But what we had then and what we have today, of course, is completely different. We've evolved quite a bit. We have a lot more features today and a lot more ways to communicate and do some things that we didn't have, in the first MVP. But so it's been, a couple of years now, and excited to see, the next steps and what else we can add to our feature set to help home health organizations, operate.
Amazing. So so your growth factor, from the moment that, you guys finally got the app released, just wanted to ask, is this also a cloud-based system that people can log into their computer, or is it just strictly all apps where you have to have like an iOS, iPad or something like that?
Yeah, no, great question. We actually have two different types of services. So Notify can actually integrate with your current EMR. We have two integrations today. So a lot of our customers, we've integrated with their EMR, so they're able to send notifications and communicate and get responses back in from their EMR itself. So there's no reason to duplicate data. So we have an API that we use for the integration. And then we also have what we call Notified Web, which is through our website, you can create an account and log in and use our interface to do the same thing, communicate and respond back, communicate in free-form text or through a notification with binary responses. The integrations have, of course, some extra features that we don't have in our Notified Web. So there's definitely a benefit to having the integration. These EMRs are great. They can set things up such as automatic notifications. So we're pushing things out like, shift reminders, or, hey, your shift starting in 1 hour, or your CPR card expires on this date, or there's bad weather coming into the area. You need to make sure that all your vent batteries are checked, and you've located the nearest hospital. But some of these things through an EMR can be automated, which is really, really cool. And we're continuing to push the limits on what we can do there.
So talking about EMRs and stuff like that, so which particular EMRs are you guys set up with that you guys can have and for the people who's watching this or listening to this, the API key is just what connects the two systems, right? Yours and the EMR.
Yes.
So which EMRs are you guys, fully integrated with that you guys can have the API key, access that?
Absolutely. So our first integration we have was with CanTime.
Okay.
CanTime is, I think they have over 250 organizations or companies on their service. Now that's just home health care only. They do some hospice and attendant care as well. But we integrated with them, and we're also integrated with an EMR called ABS. Now, ABS is specific to an organization called Bright Star Care. So Bright Star Care is a franchise organization. They have around 350 locations across the country, and they built their own personal EMR within the organization. So through them, Bright Star Care locations have access to sign on to a notified subscription as well, and have the integration benefits to that.
Yeah, that's great. So when you were talking earlier on about having to contact people like one by one, so just for the owners out there, if they realize that if you have, let's say for example, 10 new patients and you're trying to get those to whoever wants to grab them first, you might have to call all 30 people that's in your list, and that's going to take 5 minutes each time just to try to give them a call. You're paying somebody $12 an hour. You're losing a lot of time, whereas this one, within just probably one click, if you put in a message, it goes out to everybody, and then you can definitely at the same time, not get confused with all your text messages. You can actually see who's responding, right?
No, right. You're right on. Obviously, from home healthcare experience yourself, you understand how that goes. So we actually use some of those examples in our demonstrations. So, for example, you have a new patient and you have a patient in a particular area. Yeah, I mean, you can broadcast this out to 30 people in a matter of minutes. Hey, we have a new patient in your area. Here's the patient's name. Here's the diagnosis. Here's what they're looking for. Here's the time of shifts that we're looking for. And then you can gauge that interest back to you, back to the EMR or the notified interface on, okay, I sent the 30. I have 5 people that are interested. At that point, I can make an educated decision. Okay, I got 5 that are interested. I can look at particular things like, well, this nurse's experience over this nurse's experience or attendance experience. And of course, any type of, labor management that you want to roll into it as well. You have some clinicians that make X dollars and you have some attendants make X dollars. So you can kind of manage your labor as well and overtime and see what you can do to fill those shifts. But absolutely, you're getting that out to, 30 people in a matter of minutes as opposed to making phone calls throughout the entire day and waiting for people to get back to you on if they're interested or even available, to pick up that patient.
Got it. And then, one thing I was reading up as well in the notified website was that, and I actually, this never really occurred to me, but it was amazing when you start talking about the unemployment part, like when you need to be able to justify it. Can you talk about that a little bit more?
Yeah, absolutely. So, of course, being in home health care, you might have 100, 200, 300 clinicians that work for your organization. And depending on what you have available to them and what their availability is, these caregivers or clinicians might or might not have work. The problem that we ran into a lot of times were that we were calling over the phone and we would talk to a clinician and say, hey, I have this patient here in this area, here are the hours. And a lot of times we would get a response was, well, I'm not available or I can't do those hours or, that's a little too far for me to drive. We were offering the shifts, but they were not being accepted on the other end. So what we were supposed to do at that point was document everything. We would go into the EMR and document, hey, I spoke with so-and-so. I offered this shift. They are not available or they said no. So what then ended up happening was whenever we had a clinician or caregiver file for unemployment, we didn't document those things very well. So I would say we lost about 90 to 95% of those unemployment claims simply because it was he said, she said at that point. Yeah. So with notified, once again, that serves as your documentation. You can broadcast these open shifts out to 30 caregivers in the field, get those responses back. And really that is your documentation for the hearing officer. Hey, I sent this to, Nurse Stacy. I sent 40 shifts in the last 30 days. She accepted 2 of them, then declined 38 of them. Here's my documentation. And so we feel, and we've seen that, more employment claims can be won, by using, our documentation to serve as a history of record.
Yeah, so that's amazing. I mean, and the fact that you guys are, HIPAA compliant, which is also a great thing.
Yes.
A lot of people don't realize, even if the managers are aware what HIPAA compliance are, sometimes we'll have those staff members that just thinks that they could just send over some patient information just via text unsecured, and that's gonna, that can put a company in jeopardy. So I mean, the fact that you guys do have the HIPAA compliance available and it's in a secured line, that really is such an amazing thing for for companies, because at least they're a lot of people don't even think much about the HIPAA compliance sometimes, and when they get hit with it, then that's when they have a problem. So so how did you guys set it up where you guys were able to be HIPAA compliant? Is there some coding that you guys did? So you're pretty much your app guy, your partner pretty much took care of that kind of stuff, right?
Yeah, absolutely. We have a HIPAA compliance officer, and but kind of just to keep it a little bit lower level. We have 7 forms of security on the application itself. Everything is encrypted, either at rest or in motion on both sides. And at the same time, we use AWS, which is Amazon Web Services, as a partner, and they have an absolute amazing HIPAA platform as well. So we're tied in with them, and that's who we use for our services. But everything's encrypted. We have multi-authentication logins. So for example, to log in to Notified, you have to have either a username and password, fingerprint ID, or facial recognition. So those are just a few things that I think a lot of your viewers might understand about the HIPAA compliancy. But and going back to what you stated in the beginning, just about some of these organizations that might not be aware how important this is. And even some of those might not be aware of what they're able to send out, what they're not able to send out. And what I mean by more on lines of your schedulers or whoever's coordinating those schedulers, because whenever we were doing text messaging and people were doing it on their own device, we would let them know, hey, look, you cannot send this, 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 and this. You cannot do it. Don't do it. But at the same time, we were not able to monitor what was being sent. So we would say don't do it, but we don't know if it was actually going out or not. Next thing you know, someone comes in and audits you and wants to pull some records and sees that you're sending out HIPAA, or patient information across an unsecure line. And like you mentioned, it can be some heavy fines for that. Yeah.
Are you able to make phone calls within the Notified platform?
Yes, you can. Absolutely. So there's a couple of things you can do. So once again, you can send notifications, chat with an individual or groups, or at the same time, make a phone call. So if a clinician is in the field, they can pull up the Notified app. They can see who the message is coming from, and they can have an option to respond via chat or respond binary by saying, what the question could be, whether it be available, not available, yes or no, or they can press a button and make a phone call and call that person directly or call that office line.
Are there other things that you can send through the platform other than just text messages? Are you able to send like files and those kind of things as well?
Yes. Yeah, absolutely. You can send files, you can send pictures, you can send video, you can send links, as a matter of fact. So these things come in very handy. Let's say whenever you're trying to get a CPR card from a clinician in the field, and you're sending that person, a chat message or notification saying, hey, Susie, I need your CPR card. Can you please send it to me? Typically, the old process was that person was either mailing it, they were bringing it by the office, or maybe they have to take a picture of it, a screenshot of it, upload to their email, send through email, you take it, you print it off and put it in the file, so on and so forth. But yeah, absolutely. You can now send a CPR card through Notified. It comes to the desktop of the internal office team member, and from there, they can save it, they can print it off, put it in the file. And another good benefit to being HIPAA compliant, again, is think about your plan of care or your 485 or your treatment plan.
Yes.
I can't tell you how many times we would have someone call us up and say, hey, Clint, I got to the home or I got to the school and the plan of care is nowhere to be seen. I don't know where it is. And so we're having to, get out of our seats and drive it to them and make sure that they have it. That way they can perform, their responsibilities to the patient. So if Notified, I can actually upload that plan of care through a file, send it through Notified so that they can actually pull it up on their phone or device and view it from there. And one of the cool part about this is that these links that we're sending it through, they expire after 5 seconds. So they cannot copy it. They can't send it anywhere else. They can view it and view it only. So, but we're seeing a lot of good outcomes from files, pictures, video sharing, things like that.
So there's that layer of security as well. So other experience I've seen is that staff members, they may have their iPad or their Chromebooks and everything, but then all of a sudden they get to the site and they don't, for some reason, they can't go access the internet, and so they can't access their EMR from there. So the fact that they have a secondary option such as this for you to be able to send that 485 or the plan of care for those patients, it removes the that thing where some people can say, well, I can't do this patient right now because I don't have the information. So it's kind of a way to call it out, because I've had like 1 or 2 instances where people say that they can't do it because they can't access it. Now you have a way to give it to them without them saying that they can't access it. So that's such a good thing as well. And how about video? Are you guys able to send through videos as well? Like, for example, if somebody has a wound, if somebody has something that they want to show, like maybe an unsafe, when they do like the check of the house for fall preventions, and then they see that there's a lot of clutter. Are you able to send like videos like that as well?
Yes, absolutely. I'm glad you brought that up. Again, the video is very handy for that particular, example. A clinician gets to the home and they spot, either a bruise on the arm that wasn't there the day before, or a patient has fallen and gotten injured. And the first thing they want to do is report that to their nursing director or administrator back at the office, which in the past really, once again, is a phone call and kind of explaining what happened, what things look like, so on and so forth. And then there's a lot of questions. So with Notified, you can go in and either take a picture of, an injury or a bruise or anything really, and send back to the back office for that nursing director or administrator to view. and in turn ask questions back and forth at that point. But yeah, video, picture, file sharing, again, has been very, very useful in those situations.
Great. One thing, since it's like a messenger type of a platform, are you able to, like, let's say, for example, I'm the office manager, but I don't want to send any messages at nighttime. You know how sometimes you have that, you're working late. If you've been an administrator, if you've been an owner of a company, you're working late sometimes, even though you're at home, right? So, but you want to send a message, but you don't want to send it where you might wake up your staff at 2 a.m. Can you preset messages to be sent at a certain time later on?
That's a great question, and we don't have that capability today.
Okay.
But that has actually been requested by a couple of our current customers.
Okay.
And, now that you brought that up, though, I will say too that we have a priority list, and part of Notified, and really it's important to me that we listen to our customers and what their needs are about the organization. Earlier in the call, I kind of mentioned that what we have today is quite different than what we first created with the MVP. And a lot of that is through our feedback from our customers. Hey, Clint, what you have here, but could it do this? Could it do this? What do you think about adding this particular feature? And so we love that feedback. We love hearing from our customers about how we can help their organization be more productive and save time and money. And that actually has been a request of ours that is in our priority list today.
Got it. And just to make sure, this is both for Android phones and as well as iOS, Apple, right? So they won't have any problems with either type of phones?
Yes, absolutely. Android and iOS. We're actually compatible with about 60,000 devices, which was quite surprising to me before starting this business. I didn't know there was 60,000 even different types of devices. Mm-hmm. But pretty much the only phone we're going to run into a problem with if it's an old flip phone that is not a smartphone. But
Got it.
had situations with any type of other phones out there today. Yeah.
And if like, for example, somebody's interested in trying to use your company and stuff like that, how fast is your setup and integration for that? Let's say somebody calls you today and say, hey, listen, I want to be able to know more about the product. How fast can you have them set up and going where they can start using the product?
Yeah, absolutely. We created a way for our customers to sign up through our website. It's about a 5-minute process where they go in, they put in their information, their company information, an email address, and a phone number. And then once that account's created, we follow up with them with a call within 24 hours. So at that point in time, we want to just ask those questions, kind of start talking about, setting up a demonstration, a training with that particular individual or their team of individuals, and kind of moving them along through the process of how to use Notified. But we're also working on some things for our website that will be a little bit easier for, let's say, a user to go onto our website and watch a demonstration video that kind of shows them everything that they need to know about our service and how it works and how it runs. We do have videos today on our FAQs about the application itself, which is more, specific towards the clinician in the field or the caregiver in the field who's using the app. But as far as using our interface or the EMR's interface, we're working on building some things that they could simply go and watch as opposed to having to talk to us. But sign-up process is simple. I would say it's about a 5 to 7 minute process. We like to at least jump on a discovery call, get more information about their organization, and make sure they know all the benefits of how Notify can increase productivity and save them time and money. And then it's off to the races. We kind of walk them through that process, and then we're always going to be here for support. One of the, again, it's very important to me that I'm pushing our customer service as much as I am the product itself. Being in home healthcare, I understand, what these companies are up against. And we want to be there to assist them with anything that they need. So, for example, if a clinician is having problems logging in, we don't want you to call the home healthcare company and have to ask them, hey, I'm having problems logging in. Can you assist me with something? We want them reaching out to us. They have enough to worry about that. We want to take these phone calls. We want to take these support requests because typically 99.9% of the time when someone can't log in, they're just entering in, a password incorrectly or something's not capitalized. But it's very important to us for support. So we offer that up as well.
And also, for depending what package it is, it's pretty much it's unlimited users and unlimited messages, right? So it's not like you have different levels of this is how much you get for this package. It's pretty much unlimited messaging, unlimited staff, within an organization, right?
Yeah, absolutely. We are a subscription-based model. It's unlimited users, unlimited notifications. You'll see some of our competition usually charges per user.
Okay.
Again, being in home healthcare myself, I didn't want a company to be limited as far as a budget is concerned on how many clinicians they were going to have adopt Notified. My goal with Notified was to, in the beginning especially, was never to allow a patient to go without care simply because of breakdowns in communication.
Mhm.
What I mean by that is someone calling you up and saying, gosh, I could have taken care of that child if I'd only known that shift was available. So really our goal is to do whatever we can to help the home healthcare organization. We want as many people in your organization using Notified. We want as many messages outgoing and incoming as you would like using Notified. We're not going to charge you anything different for either one.
Yeah, so I mean, wow. I mean, so like, what's your plans this year and stuff like that? Are you guys going to any of the events, like like any of the state association events? Are you guys going to those?
Yeah, absolutely. We attended the TAC conference in the fall. I believe it was about 3 or 4 weeks ago. We have another one, which is down in Houston, which is the Administrators Conference. So
Okay.
your of home healthcare companies across the state of Texas will be going to this conference. And of course, our EMR conferences as well. CanTime had a user conference, super user conference in San Antonio earlier this year. We were up in Wisconsin a couple of weeks ago at the Bright Star Conference. For their owners up there. But yeah, we're always looking to attend, conferences in the area and be a part of, not only this community here in Texas, but across the country. We're actually currently in about 14 states currently. So we're starting to look to expand, some of these conferences that we go to.
Mhm.
So more than just a state level, but more across, maybe a national level, if you will.
Awesome. So like, if just to kind of, what's the best way to contact you guys if somebody's interested? What's the website? What's the and what's a number that's if they want to make a phone call to you guys?
Yeah, absolutely. So they can visit our website, which is notified.com, which is notifyd.com. So there, once they visit our website, they can do a couple of things. They can book a demonstration with us. They can book a consultation call with myself or an account executive. Or they can simply chat us from the website. So they can send us a chat where we can communicate back and forth with them through some of our customer service representatives. Or they can give us a call anytime at 855-668-4398. That rings our office line, and an account executive will answer that call and be able to help them with any kind of questions they have. Once again, a discovery call. Hey, is this product for me? Does this product make sense putting in my home healthcare organization? We like to have those calls first and foremost, just to kind of get an idea, of how we can use Notify within, your organization. So, and then of course, booking a demonstration from there. So, or you can email us as well at support@notified.com.
Awesome.
We'll be able to
Yeah.
follow.
So just going into like the home health, just you've been in the industry for that long. What's some of the changes that you've seen happen within the past decade? Because I mean, there's been a lot with PDGM. The PCR that happened in Illinois killed a lot of agencies over there. So like, what are you hearing in the field that a lot of agencies are saying that they need help in?
Right. Absolutely. Well, you mentioned, PDGM. Obviously, that's a hot topic today that a lot of agencies are dealing with. You have a lot of, these mandates coming in from the state and federal level regarding, EVV, which is electronic visit verification. So this is in place to really kind of cut out some of the fraud that's happening in either Medicaid or Medicare. And then, of course, just technology in general, over the last decade, again, kind of starting back whenever I started, we didn't have a lot of technology. We weren't using any technology. And whenever I started doing research before starting this company, I was really quite surprised at how far, not healthcare in general, like your hospitals or even your clinics were, but home healthcare in general, how behind we were in using technology within our organization. So when I started looking at, hey, what are people using things, and it just wasn't there. It was non-existent. Now I will say over the last 3 years since I started this company, you're starting to see more and more and more of people starting to use home healthcare technology. Technology in home healthcare. I think people are trying to understand that, as we see, the millennial generation kind of step into the workforce and become the primary, generation in the workforce. They're used to using applications, using technology. So back in the day where you might not got away with it or be much challenging, you're starting to see a lot more of it today.
Yeah, I mean, technology is, healthcare in general is a little bit back-ended when it comes to technology for some reason, but the home health industry, definitely, I completely agree. I mean, I still see a lot of agencies still using basic fax machines.
Yeah. Right.
So
believe it or not, you're absolutely right. Sure.
I've walked into so many offices and there's still fax machines, and I'm looking at them. I said, you should have an e-fax. You can just drag and drop it to your EMR. It's a lot faster. You don't have to have paper. You can go paperless. But a lot of agencies are still, stuck in the paper stuff. And I think that, like you said, the newer generations are coming in, but we still have a lot of older generation nurses out there and therapists, and they still don't want to, add to this little thing of stuff. So, but yeah, so I completely agree with that. Other than that, is there anything that I can do for you guys?
First and foremost, again, thank you for having me, on this call here. And, the questions that you asked more about our organization and what Notified is and what we do. But really, I think that, kind of being here and being able to use someone like you to spread awareness about Notified would be a tremendous help. Again, as a startup company, we've been in business about 3 years now, but the very beginning is the grind. It is about making phone call after phone call after phone call, email after email, LinkedIn message after LinkedIn message, just getting that information out about who you are and what you do. So, we've always, asked for if anybody can be a resource for us to share our information, specifically, in the home healthcare, hospice, industries. That's a huge help for us, because if we can get people to simply know who we are and inquire, we can kind of take it from there. So anything you can do to kind of just, once again, spread awareness about Notified would be a huge help for us.
So, we've been doing pretty well. We have our email list. Our real customers that are subscriptions of ours is around 357 last time I checked. So we have some people that's part of our online learning platform. But, we just opened up our call center 3 weeks ago in the Philippines. And so now we're just calling out marketing now to try to sign up people for the beginning of the year. And we're going to actually have 7-city boot camp next year.
Oh, wow. Oh, that's fantastic.
And we're actually going to be in Texas. We're going to do Houston, Dallas, and San Antonio.
Oh, really? Yeah, cool. Yeah. If you can, shoot me an email or a LinkedIn message on when you'll be here. I have a lot of the guys. So I work for a company called Epic Health Services, which at the time we sold, I believe it was in 2017, as I was thinking, was a fairly large organization. But where we sold, we had several of, these guys that worked there go off and start, their own agencies, their own, companies. And so I talk to them still, and I know what you're saying. I mean, they're going through that battle of, getting things set up, getting things done with the insurance companies, the MCOs, the state. I mean, it's a train wreck. And I think a lot of those guys could absolutely benefit from maybe checking you guys out or coming to that Dallas or Houston, workshop.
Yeah, we're just gonna have that out because we're just trying to reach out because we're going well a lot in our non-medical because we're actually doing a lot of Facebook marketing for non-medical now, and that's coming up with some good results lately.
Okay.
The acquisition of a patient is like around 350 right now.
Okay. Yeah.
So,
great.
But yeah, so I'll have this video up, and then if when the video once it gets edited a little bit, if you don't mind, we'll put your photo in there. We'll put the logo of your company on top and bottoms, so you have that. It's it's going to say non-sponsored because it's not a sponsored video. Just for purposes of nobody says that we're being sponsored by you guys. So we want to be able to have that full disclosure to everybody, watching the stuff. But yeah, we'll have the videos out. Hopefully we can, we can get some people for you guys. And we'll put all of your information in the bottom of the videos so that they know how to contact you guys as well, okay?
Yeah, no, that sounds excellent. I mean, that would be great. I, again, appreciate you reaching out and setting this up today. It's been a pleasure talking to you. And anything I can do for you, I said, please let me know.
You know, the fact that you're in the call, you know, does a lot for us. You know, it just gives us, you know, more content to give out there, to provide more value. That's the main thing of our YouTube site, is give so much value. You know, we have over 500 videos out there now, so that we just give out for free. So that's all we're trying to do right now, is just give value and stuff like that. And so yeah, so you being in the call is much appreciated. Thank you so much, Clint. And so I'll follow up with you once the video's up so that you're aware of it, okay? And then I can send you the link on it.
All right, Michael. Appreciate it again.
Thank you, sir. Appreciate everything as well.
All right, man. Talk soon.
Before we continue on to the video, just need to be able to take a few seconds of your time. This video is brought to you by medicationreminderprogram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's medicationreminderprogram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The Daily Reminder program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to medicationreminderprogram.com right now. There's 3 packages available, but at the very same time right now, with code 50 off, you can actually get 50% off our gold plan and the platinum plan. So just stop by medicationreminderprogram.com and let us help you get more referrals. Let's go back to the video you're currently watching. Before we continue on to the video, just need to be able to take a few seconds of your time. This video is brought to you by one of our sponsors, HomeCareAnsweringService.com. So our job here at HomeCareAnsweringService.com is to be able to make sure that you stop missing any calls, because we're going to handle the calls for you 24 hours a day, 7 days a week, 365 days of the year, even during the holidays. So mostly we're going to be doing a lot of your after-hour calls to be able to give you some time to be able to rest rather than staying up or waking up in the middle of the night to answer any phone calls coming in for your home care, your hospice, or your home health agency. It's also going to be able to help you guys reduce the cost. Instead of hiring a full-time receptionist, especially if you are in the beginning process of starting your business, you want to be able to reduce your costs at this very moment. We are HIPAA compliant. Also, when we want to contact you, we can send you messages via text message, via email, or even via leaving a voicemail in your current phone. Another thing is we are just one price service, right? We don't charge anything different for our after hours on our morning hour calls. Also, remember, we are industry specific. We only work with home health, with home care, and hospice agencies. Also, it's a month-to-month program. We don't have any yearly or 2-year contracts. So you just pretty much pay as you go. Now, we have 3 different plans. Typically, most of the people will sign up with our silver plan, which includes 100 minutes a month, which is $99 a month. And any additional minutes after that is just 95 cents. If you are starting your agency, you can start off with the basic plan, which is $39 a month, and you get a instant 20 minutes per month available for you. This is really good if you're just starting off your agency and you're still working a full-time job and you don't want to miss any phone calls. So sign up at this very moment to HomeCareAnsweringService.com and stop missing those calls. We want to be able to invite you to our 10xPatientReferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xPatientReferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. Before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xpatientreferrals.com. So sign up for a limited time at 10xpatientreferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching.